All right, so what I'm doing right now is we have a trial sizer implant in the pocket right now. It's a very small incision underneath here. And the implant is below the muscle. And so what I do is I need to release and shape the breast by releasing the pectoralis major muscle attachment in its lowest point in its attachments. And then what I'm doing is I'm just making a nice comfortable pocket that has a pretty shape for the implant to rest. Now she has some asymmetry, and so we'll be sitting her up and trying different sizes. And if you watch this, it's not pretty dissections, but it's a way for me to give her a pretty shape for the implants. And what I'm trying to do is I'm trying to bring the middle portion together so that she's got an attractive cleavage, close but not too close. And she's a little tight down here, which is the nature of her breast. So we just kind of gently start working with the implant. So now there's 250 on the right and there's 275 on the left. And then we're going to sit her up and take a look. They may end up being that they need to be the same size. We'll see. So what down and ups are is that we sit her up on the table, which gives us a best estimate about how the breasts are going to settle when she's post-op. So we're going to do 250 right, 275 left. Yes? Good to go. All right, let's go. And then so there's an extra treat today because we're going to do Morpheus8 on the tummy, which would be great. And Morpheus8 is a device using a little bit of heat energy and microneedling. And that combination with women with good skin, meaning a thick dermis, we have beautiful results with. And it's fun because it doesn't have all the trauma of liposuction or tummy tucks. So what we're doing now is we're taking out the temporary implants and we're emptying them, which is great. And then I'm going to go look inside and just see if there's any bleeding. We're going to insert the implants, which is fun because we get to use a Keller funnel. And here's a shout out to Dr. Keller because it's been a really wonderful innovation for primary breast augmentation. So what I'm going to do now is, the general term is called hemostasis. And what it is, before we finish up, we just want to make sure that there's no teeny tiny little blood vessels bleeding. And there really aren't, but we always like to be careful. I'm about to insert the silicone implants. And what I'm using in front of me is a thing called a Keller funnel. The way to think about it is that I'm decorating a cake. And it's the same kind of idea. I think Dr. Keller was watching English cooking shows when he came up with this idea, and it's very clever. So the implant's going to go inside this, and then we insert it into the breast pocket. It makes it easier, less dramatic, and it's better for the implant itself. This is the no-touch technique. What I do now is I'm setting this up, and I'm putting it into the Keller funnel, and the bottom, the tag of the breast implant's down here. And then you can just see how the implant itself pokes out a little bit, and then that's going to go into this very small incision that I've made, and we'll insert it into the breast pocket. And sometimes we need a smaller retractor, so if you could kind of grab the smaller retractor, please. Yep, there you go. Because it's so small, we have to use our smallest of instruments. We'll see if we can do this. Sometimes it's a bit of a struggle when the incisions are small, but they certainly are wonderful when they've all settled in. And so as I'm inserting this, it's a little bit of pressure, but it flows in pretty well. Once it finds its way in, it keeps going. It's nice. And now it's inside the pocket. It's a pretty shape to the pocket, and the implant will find its place in here. It's lovely. We'll do the same thing with the second implant. This implant is slightly larger because her left breast is slightly smaller. Nice and slow. All right, perfect. So I get it started, and then in a moment she's going to take out the retractor, and then it kind of slowly finds its way into the pocket. So now I'm just checking its position, make sure it's happy and it sits comfortably inside the pocket without too much tension. What I'm doing here is I'm trying to create better approximation, better cleavage here. And so that requires loosening up of the muscles, but not too much, because the big problem there can be symastia, which is another way of saying uniboob. She's got good attachments, and these aren't very big implants. So these are going to be lovely, lovely results. And this is a slightly bigger implant, so we're compensating by making the pocket a little bit bigger. You can see that it moves comfortably inside the pocket, so when I'm doing post-op implant massage, it settles down, and it looks absolutely beautiful. So we're going to sit her up and take a good look before we close the incisions. So this is a really pretty on-table result, and they're going to settle down as time goes on. You can see that we're a little bit bigger here and a little smaller here, but you can see the shapes of the breast are a little bit different. This is a little bit wider, this is a little bit tighter, and over time as we massage the breast, it'll accommodate the different size implant and open up a little bit. It'll be really beautiful and natural. So it's a lovely result. Got a little bit of healing and away we go. So I want to show you how small the incisions are. And what we have on the right is we have a 250cc implant, and the incision's closed, and you can see how small that is. It's about an inch long. When it heals beautifully, and it's just very unnoticeable. Even if someone's topless in Las Vegas, it will be beautiful. Now, this is in contrast to, this is where we did all our work on the other side, which is a little bit longer, but this is just before we close it. She's gonna have an absolutely beautiful result. And then once we complete the breast, which will be shortly, we're gonna then do the abdomen with Morpheus8, and I'm going to show you what that looks like shortly. Well, I just finished a breast augmentation, and it was really fun. To summarize what we did is that we put in silicone implants through a very small incision underneath the breast and behind the muscle. They're soft when they warm up, and they really create a beautiful shape. And you can see on table, this is absolutely gorgeous, even with the early swelling from the surgery. You see that she's a slightly smaller implant on her right breast, which is larger, and we put a slightly larger implant on the smaller left breast. And they both have different shapes, but soon the shapes are going to settle down and they're going to be absolutely beautiful and symmetric. And we'll look forward to showing you the results in the near future. So I'm starting the next stage of the procedure. And what it is we're using a device called the Morpheus8. And what the Morpheus8 is it's microneedling, and it deposits a little bit of heat energy in the tissues at different levels. And the settings we've got today are 7 millimeters, 5 millimeters, and 3 millimeters. And at each layer, it deposits a little bit of energy, and it decreases as it goes more superior or more superficial. And you can hear the sound, and that's when it goes at the 3 different levels. So I'm gonna apply it to her abdomen. And then we're gonna go all over her abdomen, which is great. And it does 2 things. It causes a little bit of heat energy into the skin, which causes it to contract, and it melts a little bit of the fat, so we give her a little better shape and contour. And then I'll go all over the abdomen. The fun part about doing this under anesthesia is that I can use a little bit more heat energy, which means I can get a lovely result in one treatment. And one of the things that is advantageous to this is that women, if they've had children, and this young woman has had 3 children, they get to be stretch marks and wrinkles around the belly button, and this helps them contract because it's a very difficult area to treat outside of having an abdominoplasty. So let me demonstrate how it works. So I'm progressing with the treatment, and she's under comfortable anesthesia because we're using quite a bit of energy here, which is just going to make her skin resurface and be a little bit tighter, and we're going to get some of this subcutaneous fat reduced from having had our kids. And I'm going to spend some extra time around the belly button because it requires extra treatment and more passes to give you the final result.